Hey everyone, my name is Bree. I'm an x-ray tech at an orthopedic office in Richmond, and in order to become an x-ray tech, I took the program through Riverside College of Health Careers and had some prerequisites beforehand to get into the program. But once I was in the program, I took anatomy and physiology classes, which reviewed all of the systems, but focused more so on the skeletal system as we got farther into the program. I took physics, starting with general physics and then getting deeper into radiation physics just to learn how x-rays were produced, how they are processed, how everything ties together to take and produce the image. I had procedures classes, which taught us positioning and how to kind of think outside the box in order to produce images that the doctors were looking for. I also took patient care and medical ethics classes, which taught how to appropriately care for any patient, regardless of age, stage of life, background, ethnicity, all of that kind of stuff. I also took an image analysis class, or a couple of them, which taught us how to critique our imaging and be able to produce good quality images for not only the patient but the doctors as well. My daily routine usually consists of days 8 to 5, and I work in an office with 4 other x-ray techs, so we rotate through 4 different x-ray rooms during the week, and each x-ray room is responsible for about 2 to 4 doctors. Usually on average we typically only are responsible for 2 doctors, but every doctor has a different specialty. So some doctors are sports medicine doctors where they're focusing on shoulders, knees, hips, anything kind of like that. We have spine doctors that their focus is primarily on the cervical spine, the thoracic spine, and the lumbar spine. We have doctors who work with just hands, wrists, elbows, more like the upper extremities. And then we also have doctors that work with just feet and lower extremities. So every doctor has their own specialty in the office, but like I said, we all kind of rotate through, so we get a good taste of each of them and get a good rotation through. So it's pretty busy at an orthopedic clinic usually. We can get anywhere from 25 to 50 patients per tech in a day. Sometimes we can reach 60 to 70 patients. It just really depends on how busy the day is. So 25 to 50 patients kind of equates to around 100 to 200 like actual images that we take of a patient. And we just kind of have to learn all of the doctor's protocols. They all have different protocols and how they like their x-rays to be positioned. So just learning to work with the doctors, working with the other techs to kind of back each other up. But it's definitely, the days go by very fast. It's a fast-paced day. You're always constantly busy on your feet. But if that's the kind of person that you are, then it's a perfect job for you. I have worked at a hospital before where it was a little bit different. We were taking x-rays of inpatients, outpatients, emergency patients, and we were also doing fluoroscopy, so live imaging of typically the small and large intestine, the esophagus, things like that. And working in a hospital, you also typically go into the OR, so you'll go in during a hip replacement or a knee replacement or anything of that nature and take images while they are doing surgery to make sure that they are in the correct place, the alignment of everything looks good, the prosthetics look good, that sort of thing. With that said, there are definitely interesting encounters throughout the day and the week. I'm going to focus more on the orthopedic office that I'm at, but we have patients we have pediatric to geriatric and all in between. So pediatric patients are pretty interesting because you have to learn how to kind of trick them and play games, especially with the younger ones, because most of them are scared. They don't know what's going on. They see a huge piece of equipment and they're like, what is this? So, and they're hurt. Typically, pediatric patients are coming in with broken arms or, ankles, wrists, things like that. So, kind of learning to play little mind games and tricks kind of help to keep them calm and help you get the optimal image that you need. Sometimes you have to be kind of tough with them, so sometimes it requires 2 techs. One tech will go in and really kind of hold the patient in the position that they need them in, while the other tech will set the technique and will expose the image and run the image. So it can be a little difficult with pediatric patients, but it's fun if you can figure out what makes them tick. Some other more funny encounters that we get a lot of, I won't say a lot, but we do get a few patients that they're not the brightest crown in the box, because we make patients change for hips or knees. So instead of putting on a whole gown, we just make them put on a pair of these like paper elastic shorts. Well, we've had a couple patients that will put these shorts on over top of their pants, which to us doesn't make that much sense, but hey. So we do get a good giggle every now and then. Let's see what else. Finding things in pockets, for sure. For a lot of exams, we will make sure they empty their pockets, take off their belts, things like that. But when they forget or don't remember they have things in their pockets, or just totally ignore that you asked them to remove things from their pockets, I've found a light bulb before, like a tiny little light bulb that the patient totally forgot she had, hair picks, lipstick, keys, phone, money clip, wallet. Sometimes it just pops up right in the middle of the image, and you kind of have to laugh at yourself and just retake it again without that there. I would have to say one of the more negatives about working in an orthopedic office is that you have a lot of casting. So patients will come in with a broken bone, they get a cast. When they get their cast taken off, they need more x-rays to make sure it's healed, and those bad boys can sometimes produce a gnarly odor. So we have some air freshener in every room, and sometimes we just go through and spray down everything. But for the most part, we've got some pretty interesting things going on. Another good one, which you would think that would be, a top priority, is that doctors, as I mentioned before, every doctor has their own protocol. So we know what that is. We have to learn it. And sometimes I think that doctors forget what their own protocol is. So they'll order something that's totally not what they normally order, and we have to kind of try and decipher what they mean. Sometimes we have to go ask them, and they look at you like you have 5 heads, like, why are you asking me this? And then other times we just kind of guess, and it turns out pretty good. Or they'll order the wrong part. I've had several doctors where they will order the left side, and it was actually their right. So it's kind of things like that, which you really have to kind of check and make sure, go over and over with the patient just to make sure that you are getting what is needed. Some other things I'm trying to think. You have to really think outside the box. I think with any kind of any x-rays that you do, because patients aren't always going to be able to do what a normal healthy person can do. You have the casts, you have people who have had surgery, or there's just certain injuries that they can't move in the way that you need them to be positioned. So you really have to kind of get creative sometimes and think, how can I get this position without making them scream, pretty much. But it's a good time working at an orthopedic clinic. Like I said, very fast paced, so you gotta always be on your toes. And my profession relates to y'all's anatomy and physiology class because, well, it's anatomy. You have to know the bones. You have to know fractures and arthritis and different pathologies in order to know what you're doing, pretty much. If you don't know anatomy, then you can't really do your job and produce the images that the doctors need in order to do their job. So, anatomy is definitely a very big part, and even how the bones work, how they are connected with each other, can really give you a good aspect of how you need something to be positioned, how something is supposed to look on the x-ray. So I also have another short video for you guys that I took of one of the x-ray rooms in our department. I just kind of walked you through what each of the pieces of equipment in any typical x-ray room are. And I did take an x-ray for you guys, not of an actual patient, but kind of showed you the steps that it takes in order to take an x-ray. But if you guys have any questions, let me know, or I guess let Mallory and her teammate know, and I can try and answer anything for you guys. She can get those to me and I can email them back to her. But I hope you guys enjoyed this and learned a little bit about an x-ray technologist, and have a great rest of the day.